So, very good evening, guys. I hope you people are ready for the journey to previous year questions of NEET and INICET from the ophthalmology. This is going to be the most fruitful session, trust my words, just before your exams, where you are having the upcoming exams, both INICET and NEET. Now, this is one thing which is not just the opinion of mine. This is one thing which every faculty, be it any platform, is actually telling you to do. Yes or no? Every faculty is telling you to look at the last papers of the NEET and INICET before going to the examination hall. So I thought, why not actually doing it and revising it along with you? Because at the last moment, there is always a hush about the controversial questions, recall questions, the right answer and the explanation. So if you are actually revising these questions with the faculty itself, yes, from the horse's mouth, I think this is going to decrease your anxiety, your apprehension about the answers. Along with this, please keep a notebook handy with you, because I am going to tell you the important topics also that you must go through depending upon these previous year questions which we are doing. You have to do certain topics, because it is not the question that will repeat, it is actually the topic that will repeat. So I will also tell you the whole topic which you have to actually revise. So are you ready? Please give me a thumbs up in the live chat and also tell me if my audio and video is clear. Yes? So please tell me if my audio video is clear. Hi Mulai. I'll try to do both. Let us see. Because we have to do all the papers, so whatever we are able to do in a decent amount of time, we will do that. If I'll need more time, then we will have to see for that. Okay, so I'll try to do both, actually, the INICET and the NEET. So anybody who can tell me if my audio video is clear? Hi Tony, Lakshmi, Rashid Mohammed. Is it Rashid or Rashid? I do not know. Hi Kala Bhairav. So are you ready? Because this is not a you can say a common session. This is one unique session where you are going to revise all the questions. So I think when you think about your final paper, you always have this anxiety that when I'm going to revise these questions, will I get the right answer, or there's a controversy from where you're doing the previous year question. So I know everything is available, but you will have to hunt for it and search for it. So this is actually a platter for you of the previous year questions from the faculty itself. So I think that is going to ace your preparation and obviously decrease your anxiety. And anxiety and apprehension are two things which actually come along with the paper. तो हम लोग यहाँ पर हैं, जितना भी हो सके उतनी मैं चाहती हूँ कि एंजाइटी और एप्रीहेंशन कम रहे, क्योंकि ये सब चीज़ें जो होती है ना, दे ऑलवेज कट डाउन योर एफिशिएंसी. तो डोंट वरी इफ यू आर नॉट एबल टू अंडरस्टैंड द हिंदी, बिकॉज आई विल डिस्कस द क्वेश्चंस इन इंग्लिश ओनली. बट जो जज्बात होते हैं वो हिंदी में कई बार हम ज़्यादा अच्छे से एक्सप्लेन कर पाते हैं, तो वो आई एम टॉकिंग अबाउट only those common things in Hindi, but everything which is academic will be done in English only. Okay, all right, so let's get started, guys. We will start from NEET PG 2018. We'll start from NEET PG 2018. Are you ready? Please keep on noting it, so that you do not have any hustle bustle at the last minute. So let's get started. NEET 2018. This is your first question. We have a 70 years old lady. 2 days. Yes, Lakshmi, I'll do that. Okay. 2 days following the cataract surgery, this lady is coming with the complaints with the complaints as shown in the image. Now, let us do it, interactively. What is this actually? What is this? What is this finding that you can see? You can see a hypopion, and hypopion is actually pus in the anterior chamber. Now, what should be the step of the management? I think the step, yesterday also I was telling you the same thing in the clinical case discussion, that whenever they are asking you the management or the test, what you should do, actually they are asking you two questions. Obviously, you have to first make the diagnosis, and only when the diagnosis is clear, then you can tell the management or the step. So can you tell me the diagnosis here? This is a patient who is having the cataract surgery. Very good. Marvelous. I think post-operative endophthalmitis is the awesome diagnosis that you have made. So I would say this is the cataract surgery has been done. So this is actually a case of post-operative endophthalmitis. So please note down, this is your topic number 1. Post-operative endophthalmitis is your topic number 1. And please keep on noting these things, okay? Because some of you will be asking me this list afterwards. So I am giving you this list along with it only. So the first topic that you have to revise before going to the examination is the post-operative endophthalmitis. See, endophthalmitis itself is a very large term, but what you people are asked about mostly is the post-operative endophthalmitis. This is the your topic number 1. Now, when you already know what is the diagnosis, then what is the treatment? It is intravitreal antibiotics, intravitreal steroids, then we have eye patching, and then we also have the intravitreal mannitol. So answer to this question is intravitreal antibiotic. Answer to this question is intravitreal antibiotic. Now see, this is a plan that you should study in the endophthalmitis. Whenever a patient is coming up with the endophthalmitis, what do you have to do? The first step. So see, this is the first step that they can ask. This is the first step. Another important question that they can ask is the first step. Very good, Bhupender, Lakshmi, Harusha. Yes, answer is A. So the first step that you are going to do is the visual acuity. They can ask you the first step also. They have asked here the management. Otherwise, they could have asked you the etiology also. Or they can ask you what is the step that you should do. So step is the visual acuity you have to take, and then you have to manage it accordingly. Now, if the vision is, so we have got two things. If the vision is more than hand movement or counting fingers, or it is less. So if it is more than PL positive, that means hand movement or it is counting finger, then what you have to do? Then you have to give the antibiotics, intracanthal injection of antibiotics. Now, whenever we are giving the intravitreal antibiotics, you always have to do the vitreous tap. First, you have to do the vitreous tap, and then at the same time, you are doing this intravitreal antibiotics. But if the visual acuity is very, very less, PL positive, then this can be a second question that you could be asked. Then go for the vitrectomy. Then along with this IV antibiotics, you have to also go for vitrectomy. So this is your question number 2. Question number 3 that you could be asked, if even there is no PL, means this is your PL positive, this is more than PL positive, and this is no PL negative, then you have to go directly to the evisceration. So question number 3 is, which destructive procedure you can do here? Evisceration, or you are doing the enucleation, or exenteration. So the second topic, first was your post-operative endophthalmitis. Second topic is the destructive procedures. You have to study. See, this session will not permit me time to discuss all these topics, but Please keep this list handy with you and you have to revise all these topics. This is the trick, the best way to study from the previous year question. So first is post-operative endophthalmitis, guys. And second is your destructive procedures. Have you got this? Which destructive procedure should be done? Where you are doing evisceration, where you are doing enucleation, where you are doing exenteration, what are the indications, contraindications, and don't forget to revise the instruments also along with this, where you are using the evisceration scoop, where you are using the enucleation spoon with the optic nerve guide. So you have to study. I have taken a separate session on the ophthalmology instruments. Look at that session. The PDF is available in the files of the Telegram group. Please take that. And it's very, very important to read all the instruments along with these destructive procedures. All right. So this was your first one. Now coming to the second one. Give your answer in the chat box. Yoke muscle for the right lateral rectus in the dextroversion. So when the eye is actually seeing in the dextroversion, I'll use the thicker pens. So this is your right eye. This is the left eye. And when we are seeing in the dextroversion, so the muscle here will be right lateral rectus and this will be your left ka medial rectus. So what will be the answer? Answer is A, left medial rectus. Then always remember what is the trick that I tell you in the classes also, in my e-Gurukul also and the live app classes also. What is the trick of doing the yoke muscles? So for this, what we are going to draw? We are going to draw a eyeball and we have got 6 cardinal gazes. So your topic number 3 is yoke muscles. You have to revise yoke muscles plus the cardinal gazes. Yoke muscles plus the cardinal gazes. You have to revise this. Yoke muscles I am telling you and cardinal gazes also. Now 6 cardinal gazes are there. Out of this 6 cardinal gazes, 3 are on the right side like this. 3 on the right side and then we have got 3 on the left side. Something like this. Now because this is on the right side, so I'll write right here and this is your left side, so I will write left here. Then fill it with the rectus muscle. So elevation mein superior rectus because this is dextro elevation. This is levo elevation, dextroversion, levoversion, dextro depression, levo depression. So right superior rectus, right lateral rectus, depression mein right inferior rectus. Similarly here I will have right superior rectus, left superior rectus, left lateral rectus and the left inferior rectus. Now in order to get the yoke muscle, just flip the muscle. Yes, you heard me right. Flip the extraocular muscle. So right superior rectus ka right ki jagah you have to take left, superior ki jagah you have to take inferior and rectus ki jagah you have to take the oblique. And see, this is the yoke muscle. This is the unique way of getting the yoke muscle, easiest, quickest, all adjectives. This will be your right inferior oblique. This will be left medial rectus. This is the question that they have asked. Right medial rectus. Then this is your left superior oblique, right superior oblique. So see, all the pair of your yoke muscles are here. Quickly note down this. The yoke muscles, the cardinal gazes, positions of gaze, and these are the things that you have to revise for this question. Yes, very good. Left superior, Rocky, it's not superior rectus. Rocky, please correct your answer. Sometimes in hurry also we can do this mistake. So please draw this and you have to do the yoke muscles along with the cardinal gazes. Right? Coming to the next question. Now this is the question that I always discuss in my classes. What is the last field to go in glaucoma? Which field is the last to go? So if you see here, what is the third thing that you have to read is the visual field defects in the primary. I think 3 I have already told you na, 4th ho gaya ye. Visual field defects in the primary open angle glaucoma. This is your next topic that you have to do. This does not mean that you have to read only this, but you have to definitely go through these topics. High yield. You always ask me the list of high yield topics. So this is your next topic. Visual field defects in the primary open angle glaucoma. Okay? Now whenever I draw the visual field defects, we always draw it like this, horizontally oval. And then we draw a circle inside it. Okay? So this is your peripheral field, this is your central field, and here we have a blind spot. Now towards the blind spot, you will have the temporal field, and away from the blind spot, we will have the nasal field here, right? So what is happening? First is these fields which are going. So first to go is your superior and inferior visual field. First to go is superior inferior visual field, followed by nasal. Then it is these defects. Here we have paracentral, then we have the sickle cell shaped, then we will have the arcuate scotoma, then I will have this double arcuate scotoma, right? So it is the nasal field which is going. So what is left is this one. It is this temporal field which is last to go. So answer will be temporal visual field. First to go is superior and inferior, then is the nasal. Now you have to tell me one question. What is this area of temporal fibers called as? Temporal fibers of the retina, right? It is this temporal fibers of the retina which are actually most sensitive to the glaucoma. So what is this area called as? Tell me this question in the live chat. What is this area called as? You have to read all the visual field effects, guys. Very good. Bhupender, Varun, Balaji, Kala, Rocky. Now, Rocky, have you amended your previous question? So what is this area called as which is most sensitive to the glaucoma? It is actually called as the Jerem's area. This is called as the Jerem's area, and that is why this scotoma is called as the Jerem's scotoma. So which another important question is, which fibers are most sensitive to glaucoma and what is the name of this area? So you have to revise whole of the visual field defects. You have to revise the configuration of the fibers, nasal fibers, temporal fibers, the papillomacular bundle, and all the visual field defects. I have given you the mnemonic also. That also you have to revise. Alright? Yes, ma'am. Good. Very good. So have you taken this 4th topic? Coming to the next one. Number 5. 50-year-old emetropic patient is there. Now because this is a emetropic patient. Now do you realize the significance of emetropia here? You have to give the presbyopic correction. Now when we give the correction for the presbyopia, first give the, is it visible, guys? You have to first give the distance correction. This I always teach you in accommodation, that whenever we are treating the accommodation, we are giving the corrections for the presbyopia. We are first correcting the distance vision and then we are correcting the near vision. So they have already said that this patient is having emetropia. Okay, that is why I can give this correction directly. Now what is the 5th question that you have to read? Changes during the accommodation. The changes during the accommodation. This is the 5th topic that you have to read. Very, very important. All the changes which are done during the accommodation. Changes in the lens, the ciliary muscle, the zonules, changes in diameter. Okay? Now, what is the answer here? So, the correction that we are giving for first 40 to 45 years, we have to give plus 1 diopter. Okay? Number 2, for 46 to 50 years, we have to give plus 1.5 to 2 diopter. Number 3, 51 to 55 years के लिए plus 2.5 to plus 3 diopters. एंड नंबर 4 56 to 60 years के लिए plus 3.52 plus 4 diopters. This is the general rule that we have to give. ठीक है, this is the general rule. Now why I have restricted it till 60 years? Because after this we have a lot of changes. ARMD is there, then we have the senile cataract that could be there, we can have the primary open angle glaucoma, so obviously there will be no emetropia. So there you have to give the correction according to the whatever is the correction coming. First you have to correct the distance vision and then the near vision. Up to 60 years you can consider the person as emetropic and you can give the corrections. Now how to choose? They have given 1 diopter, 2, 3 and 4. Right? Now 1 will be less and 4. So this will be your under correction. This will be under correction and 3 will be over correction. Therefore answer to this question is 2 diopter. Now why not 3? Always remember, never overcorrect. Never overcorrect presbyopia. Never you should overcorrect presbyopia. Therefore answer to this question is plus 2 diopter. See if you have understood. Very good. Everybody has given the right answer. I think plus 2 ही दिया है सबने. Plus 2 diopter. Yes. So they have given you. ये plus 1 है. I think misprint हो गया 1. So 1, 2, 3 and 4. So you have to give the plus 2 diopter. And you have to read the changes during the accommodation. Please note the topic also and this one also. ठीक है? Then coming to the next question, third nerve palsy. So third nerve palsy in the diabetes. So in this, what is the topic number 5? So next topic number 6 that you have to read is the abnormal pupillary reactions. What you have to read is the abnormal pupillary reactions. Third nerve palsy in the diabetes. Now in the diabetes, there is something which is different. Otherwise, third nerve palsy, you know that third nerve is the efferent nerve and optic nerve is the afferent nerve. One is the efferent nerve, one is the afferent nerve. But in cases of diabetes, you get the pupillary sparing third nerve palsy. We get the pupillary sparing third nerve palsy. That is the reason that both will be normal. So in cases of diabetes, because you get pupillary sparing third nerve palsy, therefore both light reflex and accommodation reflex will be normal. The topic that you have to read is abnormal pupillary reactions, जिसमें Argyll-Robertson pupil, Eddy-Stonick pupil, RAPD, Hutchison pupil, Wernicke's reaction, everything will come. So you have to read this. ठीक है? Next is again a direct question, 100-day glaucoma. 100-day glaucoma is the specific name which is found in CRVO. So 100-day glaucoma is a type of neovascular glaucoma. So the next topic that you have to read, this is topic number 7, is your neovascular glaucoma. 100-day glaucoma, because it takes about 90 to 100 days in a patient of CRVO to develop the glaucoma. So this is called as a 100-day glaucoma. Topic number 8 is the cherry red spot. Please don't miss this thing. Cherry red spot is a cherry over your examination. So you definitely have to read this cherry red spot. I hope everything is going fine. Very good. Amazing. Matlab, everyone is giving the right answer. Amazing response. Number 7 now. What is the most serious? They are asking you about the most serious cause. I think you must be relating this. I always tell you in the classes कि 2018 में they had asked most serious cause of neonatal conjunctivitis and most common cause of neonatal conjunctivitis. So most serious is actually the gonococcus. So The next topic number 9, is your ophthalmia neonatorum. Now, anybody who wants to do me a favor, please keep on noting this, and afterwards please post this list on the Telegram group so that the people who have not joined it live can also take this list, or you can send it to me so that I'll make a PDF and send it to you again. Okay? Anybody who wants to do a favor? So, most serious cause of conjunctivitis is your gonococcus, and what you have to read is ophthalmia neonatorum. And what is the most common? Most common is actually the chlamydia. Most common is chlamydia. Most serious is gonococcus. Okay? And see, this is the question number 9. The most common. So, most common cause will be your gonococcus that I have told you. Most common will be chlamydia, and most serious will be your gonococcus, which causes the blinding one. And here you have the most common wall of the orbit, which is involved in the blowout fracture. So this is your floor. So I always keep on reminding you that this was asked in NEET 2018 and also as an image-based question in 2019. So, blowout fracture, your topic number 10 that you have to read is a blunt trauma. Everything related to the blunt trauma in the eye you have to read. So, another important thing is your blunt trauma. Blowout fracture. Who will tell me what is the sign that you get in blowout fracture? What is the sign that you get in blowout fracture, guys? Yes, floor. Yes, floor or the inferior wall. What is the sign that you get? Sign ka naam batao. What is the sign that you are getting? Anybody? And somebody was asking me this question yesterday. What is the cause of this image? So what is this actually? This is your C-fan retinopathy. This is not a very common thing, but this was once asked in 2018. This is C-fan retinopathy, which is found in the sickle cell anemia. C-fan retinopathy, because there you get both non-proliferative and proliferative. No, Bhupender, it's not the panda sign, it's the teardrop. It's a teardrop sign, and this is a C-fan retinopathy that you get in cases of sickle cell anemia. In the C-fan, what you are getting, this in the sickle cell anemia, it is a part of the PDR. Actually, in the sickle cell anemia, we get both NPDR as well as PDR. As a part of PDR, we get this C-fan's retinopathy. This is the fibrovascular proliferation. Fibrovascular proliferation that you are going to get here. Fibrovascular proliferation. And the topic that is going to come in this 2022. ठीक है, कौन सा number हो गया? 11. Topic number 11 is your diabetic retinopathy. Must. You are going to get a question on diabetic retinopathy, be it INI-CET or NEET. I do not know, but it has to come. Now, some of the important things that you have to note here. How this sickle cell retinopathy, but somehow because I was feeling that they are actually repeating the topics after 3 years. So, this was asked in 2018, sickle cell retinopathy. So, please note down this. What are the different forms in which this sickle cell retinopathy can present? One is vascular torsicity. It can present in the form of CRAO. It can also present in the form of CRVO. It can be your vascular torsicity, CRAO, CRVO, angioid streaks. Do you remember Pepsi? I always give you this mnemonic, Pepsi. Okay? So, of this Pepsi, this S is actually your sickle cell retinopathy. Then we have the sunburst spots. So, whenever you are getting the sunburns, it is the RPE, hypertrophy that you are getting. And then you have optic atrophy And then you also learn it as a cause of TRD, tractional retinal detachment. TRD, tractional. So your topic, your Pepsi of angioid streaks and the ways in which sickle cell retinopathy can present. Okay, guys. Coming to the next question, what is the example of simple myopic astigmatism? So your next topic number 12. Okay? Topic number 12 is your astigmatism. You have to read whole of astigmatism. Okay? Astigmatism. So it is simple. Simple means it should have one plane. So simple matlab ho gaya plane and myopic is minus. So therefore the answer to this question is cylindrical and plano. If it is only spherical, then it is not astigmatism. So this is not astigmatism. This is also not astigmatism. Okay? Now if I have two signs, this will be your compound. So one has to be emmetropic and one has to be the cylindrical. That is why the answer will be B. And you have to read the astigmatism. So your 11 questions and 12 topics. Alright. Thank you guys. Take care. Happy ophthalmology.